Tonight, I am very pleased to introduce Karen Mercereau. Karen has an interesting company concept called RN Patient Advocacy. And she has a talent. She's visionary, very skillful at seeing opportunity in the midst of complexity. And I suspect that anyone that has ever had anything medical happen to them recently understands the complexity of it. Many of us may have not seen the opportunity. But Karen is an RN, a clinical RN, with a background in home-based, clinical, community-based. She's seen it all, and she saw the need for advocacy within the medical system. And I see a lot of you shaking your heads, so if you've been in the hospital, been with someone in the hospital, you've heard the words, you have to be your own advocate, you need an advocate. And Karen is here to teach us how to do that tonight. She's also brought an associate with her, and she will be more than happy to engage you in conversations and answer questions, either publicly or privately after the presentation. I think you're going to find the whole concept. By the way, there are 25 patient advocacy, RN patient advocacy groups in the United States, and they partner here in Arizona with the University of Arizona nursing program. We're grateful to the University of Arizona for that. We're not so grateful for them scheduling the Cardinals game tonight, but nonetheless, with that, let's give a warm welcome to Karen Mercereau.
Thank you very much. And thank you for having me. If you've never had a chance to meet an RN patient advocate, you're looking at one now. I have been a clinical nurse for 100 years, no, almost 50 years now, almost 48 years. And during that time, I've seen a great deal, as I expect all of you have as well. So what I'd like to ask before we get started is how many of you have encountered any difficulty at all in the healthcare system? Yeah, right. Well, back in 2002, I was working pediatric ICU at the time, and I started looking at the research. Everybody knew things were going to hell in a handbasket, right? I wanted to know where the holes were. And what I found was so much worse than I even suspected. And I thought what people need when you encounter the healthcare system is somebody who knows the ropes, somebody who knows the language, somebody who can talk to docs, somebody who can make certain that you're safe, who can advocate on your behalf. And so I started. And that was before patient advocacy actually began in the United States. I was the first one out there doing it. And now, as Phyllis said, there are RN patient advocates in 25 states. And we're partnered with the University of Arizona College of Nursing. This is the newest branch of professional nursing. And there are many, many things that we do. But what can you do? And that's what we're going to talk about tonight. And I would like to ask, if you have a question, raise your hand, all right? This is not just a lecture. This is a conversation. You have all of your experiences and you're going to have questions. So please ask. I'll call on you. And I'm also going to ask you questions. All right. So, medical errors are now the third leading cause of death. Big surprise, eh? Back in 1998, a book was published called To Err is Human by Dr. Lucien Leap from the Harvard School of Public Health. And in there, he documented 98,000 deaths a year due to preventable medical error. Now, that is a jumbo jet every day crashing. Now, if that were true, wouldn't we take notice? Right. How often do you hear about this? I think it's really important that we all be aware, because there's a great deal that you can do to protect yourself and your loved one. Up to between 210 and 440,000 people a year are dead due to preventable medical error. I think that's unconscionable. The Harvard Social Progress Index, which measures globally all kinds of parameters, and as far as healthcare, we're numbered 69. Now, how many in this room used to think that we were number 1? I did. I went to university here. I learned long ago. I graduated back in the mid-60s. I thought we were number 1. Well, we're number 69, behind Eastern Europe. Why do you think that is? Yeah.
Oh, well, I wasn't going to answer the question. I had a question.
Okay.
What goes into that index? How do they rank based on what parameters?
They are looking at health access, health quality, health outcomes. And they have a whole series. It's a very, very big program. And in fact, if it interests you, you might just want to look up Harvard Social Progress Index and see that. It's a really interesting study. Okay. And then, has anyone in here ever been misdiagnosed? Or know somebody who has? Besides me? Yeah?
We didn't answer the question, though. Why do we think that is?
Why? Oh, yeah, okay.
Remember, we were sidetracked. So
Yeah.
why is that? But we were number 69.
Does anybody have an answer? Yes.
Yeah, I think the answer is because the healthcare system is so motivated to make profit that they specialize. Doctors spend 10 seconds with you and then push you off to somebody else.
Amen.
I agree.
Absolutely. Very good. It's a medical industrial complex. And it's based on money. It's not based on us. It's not person-based, it's money-based. And that's exactly right. You're right. All right. So, up to 30% of all diagnoses in the United States are wrong. That's from the Agency for Healthcare Research and Quality, which is an arm of Health and Human Services. This year, the Institute of Medicine did a comprehensive study and found that there are 12 million misdiagnoses a year. I mean, really? Okay. The Institute of Medicine says that we spend up to $29 billion a year on the effects of misdiagnoses. Now, if you go into the ER, your chance of a misdiagnosis can go as high as 40%. What are you going to do? And I'm going to tell you what you're going to do. Because we have a lot of ideas. I've been at this a long time, and we've got a lot of ideas. That's what tonight's about. Okay, the most frequent misdiagnoses are meningitis, which is more common than you would think. Thyroid conditions. Lyme disease. Did you know that Lyme disease is the great masquerader? And it can show up in your brain, in your back, in your muscles, in your gut. It's not just a little bite and you take antibiotics for 3 weeks and all is well. It can masquerade as neurodegenerative diseases. It's very frequently misdiagnosed. Strokes. Depending upon which part of your brain is affected, how you are going to appear externally is going to be different. Right? And that misdiagnosed. Celiac disease. Do y'all know what celiac is?
No.
Okay. It's a genetically linked disease with an inability to process and metabolize gluten. It's actually pretty rare. It's much more common now than it used to be. Do you know why?
We know about it.
Yeah, you know about it. But do you know why?
Because the wheat, the molecular structure of the wheat has changed.
Yes. You better come right up here and answer. Gluten, the actual wheat before the end of World War II had 14 chromosomes, none of which were encoded for celiac. Since World War II, in an effort to expand our ability to produce more and more, cheaper and cheaper. What they've done is alter the chromosome buildup of wheat, and there are now 28 chromosomes. It's actually, I'm not kidding about this, it's actually called Frankenwheat. Right? And all of this is why so many people are gluten sensitive, because our bodies are not adapted for that kind of wheat. That's why all the gluten stuff is going on. All right, esophageal and stomach cancers, they're usually not caught until it's way late. Fibromyalgia, chronic fatigue. Cardiac disease. Are you all aware that when a woman has a heart attack, it usually looks different than when a man has one?
Yes.
Sometimes it just feels like a big bellyache or a neck ache. You know, oftentimes you don't get the radiating pain down the arm. Blood clots in your lungs. Asthma and neurologic conditions. These are the most common misdiagnoses. All right, what else is going on? Well, 10 to 20% of all surgeries in certain specialties is unnecessary. It's a big moneymaker. Yes, sir?
Are you going to be politically correct, or will you say which specialties?
A lot of cardiac surgery, I gotta say. A lot of back surgery. I'm not known for being politically correct. At this stage in my career, I haven't got time for that. Too many people are dying. Yeah.
I don't want you to backtrack, but you had thyroid conditions.
Yes.
Up on your list, the previous slide.
Can you all hear?
Thyroid.
Okay.
She had thyroid conditions up on her previous list, and I just wanted to have a chance to ask, what do you mean by misdiagnosed? They're not being diagnosed, or they're overly diagnosed?
Okay, the question being, how come thyroid is misdiagnosed? Is it underdiagnosed, overdiagnosed, whatever? Because we live in a toxic environment, and you all know that, right? All the chemicals in our environment. We have had an epidemic of autoimmune disease. One of the most common autoimmune diseases that is current today is called Hashimoto's thyroiditis. And it's very frequently misdiagnosed. Now, if you treat Hashimoto's, if you don't test for it, which most docs don't unless you ask them, right? And if you want to know what to ask them, come ask one of us, we'll tell you. If they don't test properly, they can misdiagnose you. If you have Hashimoto's instead of regular low thyroid or high thyroid, and they treat you for the regular instead of Hashimoto's, you could get in big trouble. Okay? All right. So, you have 5% of all drugs in the hospital are going to have adverse drug effects. Now, this doesn't sound like much unless you consider the millions and millions and millions and millions of drugs that get given in hospitals every single day. That's a big number. 40,000 people a year have harmful or lethal errors because of the wrong med or wrong med combinations. Another thing that's not being done is testing you genetically to see what your body can process and what it can't. The Human Genome Project changed life forever. That was our Einstein moment. Now, what we can do, and if any of you are interested in this, we'd be happy to speak with you afterwards. You can just take a little scraping inside your cheek and send it into a lab, and it will tell you which drugs you should never take, and which ones are good for you and which are iffy. And so if you find yourself on several medications, that might be something that you would really want to check out. Okay, because drugs are responsible for 106,000 deaths a year, 75,000 deaths a year from infections in hospitals. That's 205 a day. And I'm going to tell you how you can prevent, really lower your risk of infection in hospitals. Adverse drug reactions are the fourth leading cause of death. Big Pharma is not our friend. If you need a drug for all, take it. But maybe you do and maybe you don't. Something to think about. And how do you find out if you do or not? I'm going to tell you that too. Why is all of this going on? Well, gentleman in the back already answered that. Everybody's in a big fat hurry. And why are they in a big fat hurry? Well, because the insurance company says they have to be. It's all about time and it's all about money. I'm going to tell you a story. Let's say that you have a heart condition. If a cardiologist does a stent, you all know what stents are, right? It's a little thing that they open up your arteries with. If they do a stent, which takes them about 20 minutes, they get $1,500 or more in some states. However, if they spend 45 minutes with you and teach you about what's going on and actually investigate why you have that particular cardiac condition, they get $15. Now, doctors have to pay a lot of staff. What do you think they're going to go for? It's backwards. It's backwards. We should be teaching people about their bodies, working on prevention, not just giving drugs or doing surgery. All right. There's also a lack of comprehensive medical information. How many people in here are aware that your medical records are all over the place? Yeah. What's the problem with that?
They keep changing.
What?
They keep changing.
They keep changing. What else? Remember I said 40% chance of a misdiagnosis in the ER?
Records are not shared.
Records are not shared. Why do you think it's so high in the ER for misdiagnoses? Because you come strolling in or in on a gurney, they don't know you from Adam. They don't have your records. If you're there with a loved one who's all upset, might forget what's important to tell people, they're shooting in the dark. And there are things you can do about that. And we at RN Patient Advocates have designed a tool that ERs love. That ERs absolutely love, and we'll tell you more about that. Anyway, so lack of comprehensive. And you may need to be your own advocate. So who's the best advocate? Oh, by age 65, and I'm over that, and I suspect pretty much, except for my colleagues, they're not, 7 out of 10 people will have 5 or more chronic conditions. Now, if your doc has, let's see, 8 to 15 minutes with you, and sometimes that's generous, and you have 4 or 5 chronic conditions, just how thoroughly do you think that's going to be investigated? Not so good. Also, the time for new medical discoveries to become commonplace, remember I mentioned the Human Genome Project? 17 years. Unless you become educated and go ask the right questions. We're going to teach you a lot of the questions that you need to ask. Okay. So, the subject of tonight's talk, that was all a build-up. Right? That's why we're here today. Who's the best advocate? Go ahead, tell me.
You.
Yes! Oh, you jumped ahead to the next slide. How'd you do that? All right. Family member? Good. Yeah, sometimes. Right? Doctor? Friend? Biggest stake. And you're already there ahead of me. It's you. You are your best advocate. Be aware. Be aware. So, you are the center of healthcare. Back in 2004, the Institute of Medicine published a wonderful study called Crossing the Quality Chasm. They recognized that medical care in this country was substandard. And they came up with 5 things that we need to consider in order to improve health care. And one of those 5 things is go back to patient-centered care. Not dollar bill-centered care, not time-centered care, Not drug-centered care, patient-centered care. Who knows your body better than you? How many times have you sat and a doctor sat there and had the time to actually listen to you? Doesn't happen very often. Every once in a while, a little ray of hope, but not very often. How long, as a consensus, how long do you typically spend with one of your docs?
20 minutes.
20 minutes, you're doing good. 10 minutes? 15? And what if you have serious cardiac disease and early stage Alzheimer's, right? Or pulmonary disease, or renal, along with the cardiac? You see the problem. You need to participate. You need to participate in your own care. When I was growing up, we had a family doc, and I suspect all of you did too. They knew your whole family, right? They maybe gave, helped you be born. They knew everything. It's not that way now. If you are not engaged in your own care, if you're not asking questions, you are seriously at risk for having death or disability due to preventable medical error. It's you. So, how are we going to begin? How do you start? You have to learn about your condition. Where are you going to look? This will be good. Where are you going to look? The internet, really, you can't believe everything on the internet. So tell me, where are you going to go looking for information on the internet?
WebMD.
WebMD. Do you know who is a big financial supporter of WebMD?
No.
Big Pharma.
Mayo Clinic.
Mayo Clinic is very good, and they have lots of pictures, and it's written in lay language. That's an excellent idea. Where else are you going to go?
Johns Hopkins.
Johns Hopkins is excellent. MD Anderson, maybe.
I get a Harvard Health letter for women.
Harvard Health letter, that's good. That's good.
NIH.gov.
Thank you. Did you do these slides?
No, it's on your notes.
Oh, yeah. NIH.gov. This is a wonderful resource. This is where you should start. This takes you to the public health library. This has great pictures. It's written in lay language. It's a wonderful place to begin. And one of the handouts that you got tonight is, helpful websites. All right, so you have all of this in your hand already. All right, where else? The Mayo Clinic. Somebody already said the Mayo Clinic. They do lots of pictures. Very good. The only problem with Mayo, as much as I respect their work, and I think they're wonderful, they're not out there on the leading edge yet. They do integrative, but they haven't caught up with a lot of the other functional, and we'll go into that. But as far as teaching, or if you have a mystery illness, Mayo's great. National Library of Medicine. This is how you find out. WebMD is okay. It's a grain of salt, though, all right? You have to look at who's paying for these things. All right. Learn about advanced medical treatments. And there have been some significant ones. Are you all familiar? I mentioned the Human Genome Project. Do you know what that did? I'm asking. It mapped the human genome and began to find all the connections, why things happen. And one of the biggest sciences, it spawned many sciences. One of the biggest is called systems biology. Now, when I went to school, I was taught that we had all of these systems. It's like our skin's a big bag. We got neuro, we got cardiac, we got pulmonary, we got renal, right? And you have a different doc for each one, right? And they don't talk to each other. Remember the song? Oh, the hip bone's connected to the... Yeah. Well, it's true. Everything is connected. There are tens of thousands of chemical feedback loops, genetic, metabolic feedback loops. Everything is connected. For example, your gut, which I used to think was just used for making poop. Your gut is actually called your second brain. You've all heard of serotonin, right? One of the neurotransmitters, a real important one. Do you know where most of it is made?
In the body.
In your gut. More than 70% of all serotonin in your body comes from, you got it, right here. Your immune system is directly connected. More than half of your immune system is located in your small intestine. Who knew? Right? It is. And it's directly connected to the immune system in your brain. Did you know you have an immune system in your brain? Yeah, didn't. Right? They're called microglia. Okay, everything is connected. Now, I want you to really pay attention to this one. Built on systems biology is something called functional medicine. Has anyone in here heard of this yet? You're going to. This is global. You may not be aware that we are in the midst of an epidemic of chronic illness. We're not dying from pneumonia anymore, are we? We're not dying from typhoid and typhus and diphtheria. We're dying of heart disease, diabetes, and all the problems that that brings. We're dying of chronic illness. And what does mainstream medicine have for you if you're chronically ill? Think about it. Tell me.
Pills.
Pills, and lots of them, right? They wait until you get sick, and then they give you pills. Functional medicine was designed specifically to address chronic illness. And here's how they do it. They go after root cause. You have cancer? The question that needs to be asked first is why? Why do you have cancer? This is not a question you're going to hear in mainstream oncology offices, as helpful as they can be. They're not going to ask you why. I'm going to tell you a story. A 60-year-old lady calls me one day, and she said, Karen, I've just been diagnosed with stage 4 non-Hodgkin's lymphoma, and they told me there was nothing that they could do. I need to come home and get my affairs in order. Gives me chills to this day. Woman's scared to death. She said, is there anything I can do? Matter of fact, there was. Got her connected with functional physicians, an MD and the nation's leading naturopathic oncologist. And what they found out is why she had cancer. It's called terrain. Anytime you're ill, there's a reason. It's not because you're not a nice person or it's Thursday afternoon. There's a reason you become ill. It's called terrain. This lady grew up near Love Canal. She was a heavy smoker for decades. She used dark hair dye before they took the bad stuff out. She was laden with toxins, and lymphomas are well known to be toxin-based. So the doctors put her through a whole program to pull the toxins out of her body. We also tested her for food sensitivity. She was eating a lot of stuff that was causing inflammation in her entire system. Cancer is an inflammatory process. This was all 6 years ago. The woman's fine. It's not magic. It's functional medicine. I'm telling you, the Cleveland Clinic a year ago opened its first functional medicine clinic. If you go to Europe and you have chronic illness, this is what you get. Japan, China, Australia. Here in the US, we're big on drugs. It's patient-centered. Finding and treating causes. You have Alzheimer's? Why? Did you know it's possible to slow down or even reverse early stage? Anybody tell you that?
Reversing.
Reverse or stop early onset Alzheimer's. Functional medicine, listen, I'm telling you this. Based on systems biology, it's personalized, it's proactive, it's preventive, it's patient-centered. They use integrative therapies. Do you know what integrative is? Integrative medicine? Somebody said yes. No. Okay, integrate, yes.
It's a combination of MDs working with naturopathic and Eastern kinds of medicine.
Absolutely. Thank you. The answer was it's a combination of mainstream Western medicine with alternatives like yoga, Reiki, massage, many, many different modalities. And that's a combination. And they're therapies. Okay. If you want to know more about this, call and talk to one of us for an hour. All right? Look it up. In your common websites there, you'll see one for learning more about functional medicine. If you have chronic illness, you need to know about this.
Can I ask a question?
Yes.
Now, you're taking a part of medicine that I'm going to guess, and most of the insurance companies in this country are going to say, we're not going to touch that for you. Pay your bills.
Well, it's interesting. The comment was, most docs are going to say it's a lot of hooey. Did I get you right?
That and your insurance company.
And your insurance company. Remember I told you it takes 17 years for something to go from leading edge to mainstream. This is pretty new. The Human Genome Project, which spawned this, right, only happened at the turn of the century. But I'll tell you what, the Institute of Functional Medicine is training hundreds of doctors every single year, and there's a way that you can find them. There are quite a few right here in Arizona.
Will your insurance cover that, though?
No, your insurance will not cover it. However, what your insurance will cover is most of the labs that they do. Okay, your doc probably isn't going to know about this. Do not let that stop you from learning. Integrative medicine, we've already done, and you can learn more right here. National Center for Complementary and Alternative Medicine at NIH.gov, and that's on your list as well.
Isn't there a center for integrative medicine in university?
The question was, isn't there a center for integrative medicine at the university? Yes, there is. They do not cover functional, but they are teaching doctors to go and paint outside the lines, learn something besides waiting for symptoms and giving drugs. They have done a tremendous job. Andrew Weil has done an amazing service to this entire nation. So, one of the things you absolutely must do in advocating for yourself is learning about your meds. How many in here are on more than one med? Right. More than 3. More than 5. Okay. You better know what you're putting in your mouth. And what they give you at the drugstore isn't really the whole story. So, let me tell you how you're going to learn about it. Remember I said medication errors are now the 4th leading cause of death, 106. And these are just the ones we can count. 106,000 dead a year. You have to know about your meds. And maybe there's a way that you don't need those meds. Maybe there are alternatives nutritionally or with supplements. And there are ways to figure this out. Okay, first of all, how many of you have a list of your medications right now in your wallet? If you do not, I'd like you to go home tonight, write them down and stick them in your pocket, stick them in your purse, put them in your wallet. Something happens, you go down, and you're allergic to something or you're on a med, you could get in serious trouble. So please, carry a list of your meds at all times. How many in here have heard of something called, this is government sponsored, the Beers List? The,
College.
the Beers List is a pharmaceutical site that lists all of the drugs that you should not take if you're over the age of 70. It not only tells you which ones you should not take, but it tells you which drugs you can use instead of those that you should not take. And the link is on that list of websites that you picked up at the table, okay? So I want you to go home and sometime this week check and see if any of the meds that you are on that Beers List, because they could be making trouble for you in your body, making you worse instead of better. Okay? All right. What about it? It's working, it's not working. What are the actions? What are the interactions? What are the side effects? Did you know that all commonly used medications block certain nutrients?
Yes.
So what do you think that means? If it's blocking nutrients and you're chronically ill.
Well, you take vitamins or something like that. You take
Yes, yeah, but how are you going to know which vitamins to take? Let me give you an example. Although it shouldn't be, Nexium, Prevacid, Prilosec, called proton pump inhibitors, are given for everything, pretty much. You have a bellyache, they give it to you. What they don't tell you is it blocks calcium, it blocks zinc, it blocks magnesium, critical for heart and brain. It blocks B12, critical for brain and nervous system. So if you're on any of the purple pills or anything like that, next time you go to the doctor, you say, I'd like to check my calcium, my zinc, my magnesium, right? My B12. Because if you're low, it's a very simple fix and it doesn't cost a lot of money. All right? Replace what is not being absorbed. All right. So there's something here that, right here, you see this rxlist.com? You need to bookmark this on your computer before you take medication. Do you all use computers? You all look stuff up on Google? Okay. In the Google search bar, you put the name of your drug and then rxlist.com. And you will get a thorough understanding of the actions, the interactions, the problems, what are the side effects, what are the warnings, and it's all very simple to read. It's not like these giant drug handouts that you can't read unless you're a pharmacist. This is where you go. And then, if you're on more than one medication, there's another wonderful site. It's called drugs.com. So you go to drugs.com and you click on Interactions Checker. And you have to agree that they're not diagnosing you. You know, you sign yes, you agree. And then you list your meds that you're on. And it'll tell you the problems. It'll tell you the interactions and what could cause you serious trouble. So when you go to your physician, wouldn't it be helpful to have this information? Because I'll guarantee you, your doc doesn't have time to do this. And there are so darn many drugs out there, they can't keep track of all of this in their head, along with everything else they're doing. So this is part of your preparation before you go to your doc. Okay? Does that make sense? And then there's a place here, and again, this is in your handout. Find out what nutrients your drugs are blocking. Because then when you go to the doc, all you have to do is say, would you please check my zinc count, whatever's being blocked. Antibiotics are famous for blocking all kinds of stuff. Right? A lot of heart drugs block nutrients. So find out. Go to this site and find out what nutrients are being blocked, and then ask your doctor, would you please check my, whether it's magnesium or iron, whatever, folic acid. Because if you're low, simple fix and cheap.
Why can't the doctor do that? I mean, he only has to do it once and then just copy it.
The question was, why won't your doc do that? He only has to do that once and then copy it. Because everybody has different drug combinations. Everybody's body is different. And they are listening to their pharmaceutical reps. All right? Do you know that there are 2 lobbyists from Big Pharma for every single person in Washington in Congress, Senate and House? 2. And doctors, even though they're not allowed to take money for prescribing, they get free trips. It's called educational, right, journeys. They get plenty from Big Pharma. There are docs who are making more than $200,000 a year from Big Pharma because they know how to milk the system. It's part of the problem. And I need to stress this. It is not that doctors and nurses have become substandard, because we haven't. There's always the good, the bad, and the uh-oh, right? But it's the system, guys, and that's why it's so important for you to learn these things that you can do to help protect yourself. What about your family history? Do you know how important that is? What did your grandma die of? Right? Go to My Family Health Portrait and fill it out, and when you go to your doctor, they always ask on the little form, right? What's your family history? This asks more questions, and you take that information to your physician, because that will help indicate where the problem areas are going to be for you. Does that make sense? Pardon me? Well, you make sure he reads it, or she reads it. I call it big smile, feet don't move. Yes?
Is that address on our sheet?
I think it is. Jessica, is it on the sheet? If it's not, it's in the handout that will be on the site, the film, so you can access that information. All right. So, how do you pick your doc? Oh, this will be good. How do you pick your doc? Go ahead. Somebody tell me. Yes.
I see what his background is, what school he went to. Usually that's about it.
She said, I see what his background is, what school he went to. How do you find out what school he or she went to?
Usually if I put in his name, I can get a background about the doctor. What school he went to, if he had any specialties or...
Okay, that's a good idea, and I'm going to tell you an easier way to do that. That'll give you even more information. How? Yes, sir.
So what I did was I went with, when I first moved here, I was with Northwest. And then after the shooting of Gabby Giffords, and I saw what the doctors at U of A did for her, I go, you know what? I want a doctor that can admit you to the University of Arizona Medical Center. So I switched doctors. Now I got to go out to Tucson every time, but at least I feel a lot better.
Okay. The answer for this gentleman was to get hooked up with the university system, particularly following how they were able to treat Gabby Gifford. I will tell you, however, that there is a whole new system in place down there. Things are changing. Be aware. It's Banner. And they're changing the whole playbook. So just be aware. I'm not saying it's bad. I'm just saying, be aware. Yes, sir?
A lot of people check who's near, who's in network.
Who's in your network? Okay. You know that all docs are not created equal, right? Did you know, and Ann Landers told us, that 50% of doctors graduate in the bottom of their class? Yeah, it's true. Think about it. I don't care how nice they are. I don't care if they have good bedside manner. I want to know where they went to school, How well did they do? Have they had insurance issues, right? Are they board certified? Is their board specialty current? How many offices do they have? If they have 3 offices, I'm not interested, right? They're spread way too thin. They're not going to pay attention to me. Okay, so how do you do it? You go to the State Medical Examining Board, and here in the Arizona, it's azmd.gov, and you find a doc or doc search, and you put in the doctor's name, and voila, you find out where they went to school, when they went to school, what specialties they have they won any awards, have they published, are they board certified, is it current? How many offices? It gives you the whole 9 yards. You have to vet your docs. They hold your life, pieces of your life in their hands. You better know who you're going to. It's not all that unusual, even today. Your neighbor says, oh, he's so nice. Well, I don't care, you know? I've been around a long time. I've worked with docs for 50 years. And there's some beauties out there, some beautiful, wonderful, wonderful, and there are killers. They aren't many. But this is a wonderful way to find out about your physician. Okay, and you can interview your physician as well. Research the hospital. You got to go in the hospital. Here's something you can do. You call the administration office. Oh, this will get them. You call the administration office and you say, what were your last Joint Commission ratings? They'll go, who is this? Any hospital or health institution that accepts federal dollars, Medicare, Medicaid, right, has to, every 3 years, pass what's called JCO certification, things that make administration weak in the knees. Because if you don't pass, or you get a ding, that could cut you from getting reimbursement. So this is a very big deal. Now, they are checking every department. Maybe they're crummy on they're in nutrition, but they're really good in infectious control. Ask the question, how did you do on your last Joint Commission? Were there problem areas? Because if you have a choice of hospitals, wouldn't you want to go to the one that does better? Yeah? Yes?
But isn't the hospital, isn't the doctor you choose has certain connections to certain hospitals, and if that's your doctor, you can't necessarily choose your hospital?
The question was, what if your doc, you go to your doc and he or she has privileges at a hospital? Typically, not always, but typically physicians have privileges at more than one hospital. Especially the younger ones. They're spread out a little bit more. Okay, now here's a way that you can compare hospital ratings yourself. Consumer health ratings, health grades. If you get a chance and you've got a real big problem, find out what hospital specializes in that. And I don't mean just their marketing message. Find out who specializes in that condition. Research like, why do you have to go to rehab? Now, their brochures look very nice, right? Check it out. And here's how you check it out. You go to Medicare.gov, and they will get rated. And you go to carepathways.com. How frequent do people fall in those places? How frequent do they get infections, like urinary tract infections? How good is their nutrition? What is their staff ratio? Especially on the weekends and at night. This is where you're going to get that information. So, if you think you're going to go to rehab, check it out. And health grades. Okay, before you make big decisions, get a second opinion. How many in here have done second opinions? That does my heart good. A lot of hands went up. Do you know that only 30% of Americans get a second opinion? What if you're told you have pancreatic cancer? Well, you're deer in headlights, number one. You're scared to death. One of the ladies that I work with, named Tricia Torrey, who teaches patient advocates how to develop their practices, was told she had pancreatic cancer. She didn't. It was a lab screw-up. But if she hadn't persisted and asked the questions and gotten a second opinion, she would have gone through the treatment, which might very well have killed her. All right? Please, you be one of the 30%. And now, remember I told some of you there's a pop quiz. Here's one of the pop quizzes. If you're going to get a second opinion, where do you go? Huh?
Outside your group.
Outside the group. Thank you. Yes. You never go for a second opinion in the same group because they're going to back each other up. That's the rule. All right. So, how do you get ready for your second opinion? Do not expect that your records are going to be transferred from one office to another in a timely and efficient manner. It is not going to happen. Take them yourself. Go to your doc, sign the waiver, get your records, and hand carry them to the second opinion, all right? And if you have had MRIs, bring those films, the MRIs or CT discs, bring the reports. And if you by any chance have been fortunate enough to have a Medicaid, this is a tool which is unique in all the country, and we nurses created this. It is a chronology of everything important in your healthcare and all of your labs. ERs wish everyone in the country had one because they know exactly what to do once they see this. So if you have one of these things, bring it with you. Have a trusted friend and a tape recorder. Bring a list of questions and then ask them. Big smile. Feet don't move. Make sure they answer your questions. Okay, you're going to go to surgery. If there is any possibility of you selecting the time, you be the first on the surgery schedule. Why? Yes, exactly. So your doctor is awake and alert. If you're having an emergency and the only time they can squeeze you in is 7 o'clock at night, you say, then you got to do it. But if you have any chance at all, you go in the morning. All right? Please read your surgical permit. Why do I say that? Have any of you actually read the entire surgical permit before you went for surgery? Yes, this woman's shaking her head. And what did you find on there?
Things that
I can't hear.
I found several things that I would not agree to, so I simply blacked them out.
She found several things that she would not agree to. There are things in there like, if this happens, we're going to do this. And if that happens, we're going to do this. And OPS, we're going to take pictures. And OPS, we're going to have students. And OPS, a resident might do your surgery. Read that permit and do exactly what this lady did. If you don't agree, cross it out. That is your legal right. Yes?
And then they proceeded to tell me that, well, the doctor's not going to do your surgery. And I said, well, that's his privilege, but present my paper to him, get his reaction.
She said that she was told after she was scrupulous, according to her legal right, and she crossed off what she didn't agree with, they said the doc wouldn't do the surgery. And she said, well, give it to him. So did he do the surgery?
Yes.
Yes. Okay, you want to prepare. There are things you can do to prepare. You can prepare your immune system. Give us a call, we'll tell you how to do it. Take probiotics. Why?
Because of your gut.
Huh?
Because of your gut. Having it being part of your mind.
Yes, exactly. Because half of your immune system is in your small intestine, and your small intestine has a very specific bacterial mix in there, which when you're stressed and you're taking a lot of medications or antibiotics, that's going to be all screwed up. And that means your immune system is going to be compromised. So why not act preemptively and take probiotics? Learn how to do deep breathing. You're going to have belly surgery. One of the biggest problems with belly surgery is pneumonia or lung infections. Why? Because it hurts. It hurts to take a deep breath. And if you're not expanding those lungs, you're at risk. There are ways to learn how to do it that have to do with a pillow. It's really very easy. Learn how to do deep breathing. Learn how to move. There are ways to move so it doesn't hurt as much. You're not moving, you might develop blood clots, all kinds of things can happen. Learn about the nutrition that'll help you heal faster. Ask one of us. Okay, so you're going to the hospital. Bring a family member. Where is it? The Joint Commission, remember I mentioned Joint Commission, back in 2003 came up with a program called Speak Up, because they knew the problems that were happening too. And these are things that you do to protect yourself in the healthcare system. One of them is take an advocate with you. Doesn't need to necessarily be an RNPA. Someone needs to be at your bedside 24 hours a day, because hospitals aren't staffed optimally, particularly at night and on the weekends. You need somebody watching the door. I call it watching the door. What if your IV's not dripping? You're not going to notice. You're drugged, right? That means you're not getting the fluid and the medication that you might need. What if you start bleeding and your call bell's not working? What if you get up to go to the bathroom, boom, you go down? You're not next to your call bell. Nurse was just here 15 minutes ago. You're not going to see her again for a while. She's busy. Yes?
Are your services covered by insurance?
The question was, are services covered by insurance? What do you think?
No.
I'll tell you, when I started this back in '02, I went and talked to Blue Cross, I went and talked to self-insurers, I talked to insurance, and they all patted me on the head. That's nice, lady, and don't let the door hit you. And it became very clear that if I did not follow the party line to get reimbursed by them, okay, they weren't going to reimburse. Well, I would be part of the problem, right? I would be part. That's not patient-centered. The Institute of Medicine, patient-centered. RN, patient advocacy, patient-centered. So that is exactly why we are not covered. However, we are investigating. My colleague and I were talking about it on the way up here. There's a possibility that we may have figured out a way to get this covered. This is the Medicaid. This will save your life, I'm telling you. And I'd be happy to talk to any of you afterwards and explain and show you what this is. Okay, so somebody comes with you. They're going to have to sign a hospital release so the docs know that they can talk to you, or talk to them about you. You've heard this, and I'm going to say it again. If you're blotto, you're medicated, you're on anesthesia, you're on drugs, whatever, the person who is with you, ask what every single medication is. Nurses aren't going to mind. Trust me, we won't. Ask. Mistakes happen every single day. If anything looks weird, now you don't have to be a nurse or a doc to go, that looks weird, right? If anything looks weird, you get out to the nurse's station and say, this looks weird. I need the nurse to come look at this. Make a list of questions daily for your physician and ask them. they're going to be in a big hurry. But if you have your questions already listed, you'll get them answered. All right? For people our age, we're not used to, well, I am because I've been a nurse forever, but most people my age and older, you're not used to asking the docs the questions. Don't want to get them upset. So, it's disrespectful. It's your life. It's not disrespectful. Courtesy, always, respect, big smile, feet don't move. Get those questions answered. Make certain that everybody knows your allergy. They're going to stick that little bracelet on you, right? That says your allergies. Make sure it actually says what you're allergic to. Because sometimes the wrong bracelet gets on the wrong person. It happens. Ah, yes, the wrong leg got cut off. You can mark your own surgery. It's this kidney, right, with a magic marker. It's this knee. If your doctor doesn't make a mark on your body, you make it. All right? That's not hard. Bring a magic marker with you. Make sure that everybody washes their hands. This sounds very simple, but then when they're in a big fat hurry and they're going back and forth, this doesn't always happen. "205 people a year die from hospital-acquired infections. What can you do?" I'm asking. Huh? Wash your hands.
Bring that Puritan with you.
Yes, bring some stuff with you. Remember, germs live on the side rails, on your bed table, on the telephone, on the TV remote, on your nurse call bell. So how about bringing in some Clorox or bleach wipes and wiping them down every single day? Is that a good idea? Yeah. Okay. Another little problem is, and I have been guilty of this, every single nurse and physician has. You're in a big fat hurry. You got 6 patients that you need to see right away, right? And you got 10 minutes to do so. You got 1 stethoscope. If they're not in isolation, you're going to go from room to room with your stethoscope. And I'm going to stick it right on your chest and you've got a belly infection. Then I'm coming over to you and you've got lung trouble and I'm sticking this dirty stethoscope on you. This happens every day. So why not keep some alcohol swabs right by your bedside, and before anybody sticks that stethoscope on you, and if you can't do it, then the person who's there with you can do that. That can save your life. It's a simple thing. It's a simple thing. Bring those bleach wipes and use them every single day. Wipe down everything. Bring your own water. Now, why in heaven's name would you bring your own water? That sounds just ridiculous. All right. I'll tell you. Because they don't sterilize your water jug. It's sitting there in a dirty environment. They fill the water sometimes twice a day, sometimes only once a day. So you got this dead water sitting there in a germ-infested area. Why not bring your own water and you take the top off and you drink from it and you're not using anything that hasn't been cleaned for you? All right, it's very nice they give you a little water pitcher. Those water pitchers are dirty. All right, bring your own pillow. Why would you bring your own pillow? Come on, come on. Aside from the fact that they are very uncomfortable.
Other people have used them.
That's right. Other people have used them. They're covered in plastic and they're sewn together. Now, when a patient leaves the hospital, we take an alcohol wipe and we wipe it down. Do we get in where the threads are? No. So, bring your own pillow, bring your own pillowcase with your name on it, so nobody takes it away. All right? Simple. These are very simple things, but it can save your life. All right. Bring your own toiletries. Those little hospital welcome kits, they're sold to the lowest bidder. Need I say more? Bring your own stuff. Bring your own body lotion. And bring your own slippers. Now those little socks they give you with the little things on the bottom so you don't slide, go ahead, tell me how well they work. Why not bring your own slippers? Huh? They fit you. They're not going to slide. All right? And it is your right, just as this lady found with the op permit, it is your right to refuse treatment. If you don't understand and you don't know why they're doing something, or you disagree, I don't care what that physician says, if you disagree, you can refuse. That is your legal right. And then you can get a second opinion, you can find out more. I'm not saying that you won't do what they're asking you to do. Maybe you will, maybe you won't. But until you really understand what it is they're asking you to do, if you got a question, it is your legal right to refuse. Big smile. Be eternally curious. Albert Einstein. I have no special talent here, right? I am only passionately curious. Be curious. Be curious. Do not accept just because so-and-so said. Be curious. Be safe. No question is too simple. The really bad question is the one that doesn't get asked. And then you've all heard that. You taught your kids that, right? When they went to school. Well, it applies now too. When you call one of us, we're a whole new breed of nurses. And we are expert not only in traditional Western medicine, but in integrative and most especially functional. We are a special breed. And we are here because we need to be here. I'll tell you another little story. Back at the turn of the 20th century, we had a giant influx of immigrants, right, from Europe. And they went and they lived in tenements. And what happened in tenements? That's right, disease, diphtheria, tetanus, typhoid, cholera. How did nursing respond? Nursing, I tell you what, we are adaptable. Nursing came up with public health nursing and visiting nurses and taught people nutrition, taught moms how to properly clean things and turn the tide. Well, I'm telling you, that's what our patient advocates are doing now. We are teaching. You all got a handout. We go out and as a community service, we go out and do these presentations. Teach people, give you the tools to protect you. So, when you call one of us, protect yourself from medical errors. Get a Medicaid. A chronology of your whole health history. What if you're given a diagnosis? They tell you have lung cancer. You have non-small cell lung cancer. Maybe you do, maybe you don't. Shouldn't you understand what it means? Shouldn't you investigate the integrity of that diagnosis? We know how to do that. We can teach you how to do that. And then, because we're not always going to be there, you can teach your family. You can teach your neighbors. Let's spread the good word. Give people tools. Okay. Learn how you can slow down or reverse chronic illness. Do you know you can reverse fibromyalgia? You can reverse heart disease. You can reverse chronic fatigue. You can even reverse cancer. You can reverse a lot of things. Does that mean it's all reversible? No. But the possibility is there, but you gotta know how. You gotta know the questions to ask, right? We can teach you. Learn the full range of your treatment options, including all medical paradigms. I'm going to tell you another little story. I know I'm running on here. I'm near the end. Guy comes to me, he's going for big belly surgery, he wants to make sure, he's in his 70s, he wants to make sure that he's safe. And they were going to put in a defibrillator, a pacemaker defibrillator, because one of his heart measurements said that at this point you get one. Well, that didn't sit right, because the guy tolerated all of his cardiac exercise. He was thin. He ate better than I ever dreamed of eating. He wasn't on medications. You know, he had heart problems before, but he had totally made all of his lifestyle changes. So I asked his physician, he said, oh, no, we got to do it because the American Board of Cardiology says at this number you got to do it. I said, will you give me a minute? So I went to work. We look globally. We're number 68. That means if we are investigating your treatment options, we got to look all over the planet, right? I found a beautiful study in the European Journal of Heart Failure, which listed 4 things that you need to check before you stick that defib in. And guess what? He only had 1. So I take my study, and I've got it underlined and highlighted, big smile, take it into the cardiologist's office and show him. And he looks at me, and he looks at this, and he goes, this is amazing. We're not going to put that in. That was 4 years ago. Guy's fine. I'm telling you, got to know what questions to ask. All right. Learn the full range of your treatment options. Learn the full range. Coordinate care. Docs don't have time to talk to each other. It's not because they're bad. They don't have time because they're in a very big hurry because the system demands that. So what we do is we coordinate the care. We facilitate communications. So your cardiologist knows what your renal's doing, knows what your GI is doing, so it's all one. So everybody knows what everybody else is doing. And you know what that does? That really reduces your risk of medical error. Can help save your life. Okay, we advocate on your behalf. We know what questions to ask. We've been around a long time. I'll tell you what, nobody gets to be an RNPA unless they pass a whole series of questions. You can't just pay your money and come to the course. You have to be an expert. And I'd like to introduce 2 experts right now. One of my colleagues, Jessica Kogel, RN patient Jessica.
Hi.
RN patient advocate. Dr. Judy Hauser, RN PhD. They are expert. They're the best out there. And that's who we're looking for. Okay. You can call your RNPA, help you make sense of your meds, and your current treatment plan, help you understand what's going on in your body. Create your Medicaid, reducing your risk of medical error, to ensure the integrity of the diagnostic process. 12 million misdiagnoses is a very big number. Don't be one of them. Let's ensure the integrity of the diagnostic process that you're going through. Research the full range of treatment options, as I said. Important websites, you have them all on the handout, so I won't go over them right now. But your health care, your whole health and well-being is a puzzle with many, many pieces. Learn all the pieces. Be your own advocate. And I thank you. Sometimes all you need is an hour or 2 with one of us to explain what's going on, tell you what to ask your doc. Sometimes you need to work with us big time because you've got bigger problems. We serve you in many, many different ways. It's not one size fits all. Yes, was there another question?
So what's the highest quality rated hospital system in the Tucson area? And are there any hospitals that you would recommend we not use?
Oh man, I remember I told you I don't worry about political correctness. If I'm really sick, I'm leaving Tucson.
You what?
If I'm seriously ill, I'm leaving Tucson.
Well, you're leaving Tucson.
So where are you going to go?
For big time stuff, it depends on what's wrong with me. If I have a mystery illness, I'm going up the road to the Mayo. You go in through their clinic system, they are par excellence, right? It depends on what's wrong with you. You need to know, there are different specialties all over. If I have common variety stuff, I'd stay here in Tucson. As far as one hospital system being better than another, to be perfectly honest with you, I don't see a standout. I used to think it was Carondelet. They got taken over by Ascension Health, and now Ascension's pretty much like Banner. They're cutting nursing. You can't cut nursing and expect quality to be the same. You know what? They have nurses who have 3 months of experience leading entire units. There's something wrong with that. Right? So I'd like to say go here or there, but I don't care. So, yes, question?
How are you being paid? By the hour, by the project? How do you get paid?
Question is, how do we get paid? Sometimes it's by the hour, sometimes it's by the project. It depends on what you need. If we're going by the hour, it's typically $100 an hour, but we're fast. We are highly experienced clinical nurses. We know what we are doing. Yes?
What's the Medi-Key? What is the cost? The other question is, if I hadn't come to this and I called Pima County Council on Aging, would they even know who you are?
Oh, they know all about us, yes.
Well, they didn't 5 years ago.
Well, actually, that's because they changed their staff. In 2002, when I started this, Pima Council on Aging was my first stop. I went there and said, here's what I'm doing. They said, do it, do it. I have spoken to them. I've done presentations. Yeah, they know about us. Yeah.
5 years ago, I called them from a nursing home and said, I want a nurse who is a patient advocate.
They'll give you our number.
They said, we don't even have a list of those people. Honest to God.
Thank you for telling me that. I'll take care of that right away. Because, we've been in their paper. I've done presentations. Thank you very much. Would you make a note of that? Thank you. Yes?
Is the Medi-Key something that's proprietary to what you do, or is it available to any of us?
Well, it's available to you if we do it for you. Let me tell you what this is. We did this because people are dying from preventable medical errors and misdiagnoses. And so here's what we do. We collect all of your medical records. I've gone back 40 years. I want everything. I want everything I can lay my hands on. And then we ask you to fill out an extensive questionnaire. So we combine your answers on the questionnaire, and then we do something pretty surprising with all of those medical records. Can you guess what that is? We read them. Yes. Nobody has time to read records anymore. We do. And we are experienced clinical nurses. We know what docs need to know. This is for your doc. This is to save your life. We know what docs need to know. Now this one I'm holding up here, right? This is double-spaced, 5.5 pages. This is a stack of records this high. Now, assuming they even collect all the records, what doc has time to read that many records? They love this. ERs love this. So what we do is create a chronology, year by year. Here are the important things that happen. Here's what your docs need to know. Docs love it. And then it's 3 parts to the Medicaid. The second part is lab trends. Now, when you're ill, there are certain labs that need to be tracked, indicated by your clinical condition. So what we do is we trend them out. We pick all the ones that are relative to your clinical presentation, and we trend them out over the year. Docs almost cry when they see this. I can't believe that nobody figured this out. It took nursing to go, hey, maybe they need to see the labs, right? Because nobody's got time to go through pages and pages and pages. It's all here in one spot. And then, and this is the jewel in the crown, this is called Roadmap to Health. These are system by system, all the questions that have never been asked, all the suggestions for physicians to see, nutritional changes, possibly medications, procedures, supplements, and it's a huge teaching tool. So this is a roadmap to health. If you do everything on here, you're going to come out the other end way better off than you are now. I can guarantee it. I've been doing this a long time. So that is the Medicaid. And we're figuring out how to get that covered. And how much it costs is entirely reliant upon how many records you have. I mean, it takes time to go through and do this, right? Any other questions? Yes?
If you go, and you were saying get a second opinion, sometimes a third. If you go for a second opinion, do you tell your first doctor you're going for a second opinion, or you just do it and don't tell?
That's an excellent question. The question was, if you're going to go for a second opinion, should you tell the first doc that you are? It's entirely up to you. Legally, it's your right. I think it might be a point of courtesy to say, I have some questions, and because this is so important, I have decided to get a second opinion. And if somebody doesn't like it, you're in the wrong office. Seriously. Okay, any other questions? Yes?
Are you throughout the nation?
Yes, we are. There are RNPAs now all over the country.
If I had a friend someplace, would I tell her to just get on the net? And
what you would do is call the main office, and I'll tell you who's close by.
Okay.
Okay? We have a national network. The biggest thing, and I got to tell you, the biggest thing, because this is a new branch of nursing, the biggest issue for us is telling people we're here. Telling people we exist. So tell people. Yes.
What does the American Medical Association feel about you? Because you're criticizing a lot.
Oh, that's a wonderful question. The question was, what does the American Medical Association... I don't think they paid any attention to us. We're a mosquito. We're not big enough to cause them trouble yet. But I will tell you that when I first started, all those years ago, physicians were like, who are you? I mean, I don't know if they expected my head to turn around, but who knows? But now, physicians are very accepting of us because the patients who work with us generally do better than those who don't. And we make them look good. We catch those mistakes. We might take them aside and go, were you aware? Like the guy who was going to stick that pacemaker defib in that old man's chest for $40,000 and lay him open, there's a chance of infection and a failing defib. He was very grateful. So individual docs don't have a problem. When we get big enough, I think Big Pharma may come after us. Because drugs are not the only answer. They're only part of the answer. And there are many other things that you can do. And any other questions? Yes?
In the beginning of your presentation, I thought you mentioned something about telling us how you could find out your own genome.
Oh, yes. There are many ways that you can find out your own genome. There's one called write this down, 23andMe. Costs they just upped it to $200. And that will map your whole genome. And then you send that information to another company called Genetic Genie, and that's free. And they will tell you what a lot of your risk factors are. But the one specifically, Phyllis, that I refer to is something called pharmacogenomic profile. Pharmaco, having to do with drugs, genomic. And we can hook you up with a company who will do it. Costs about $500. Cheek scraping, send it to the lab, and it will tell you what drugs are safe, what are iffy, and which ones you should not be taking because of your genetic makeup.
And I just heard of a woman who is finding this out for in her case, breast cancer, whether or not it would respond to radiation, chemo, which kind of chemo, et cetera. Is that prevalent?
Absolutely. If you have cancer and they're going to give you chemo, guess what? They can find out genetically which chemo is going to work for you. And they're going to actually be able to track the genes that are involved in that cancer so they know what to give you, what's going to work and what's not going to work. Pretty much before that, it was one size fits all. Well, you know what? One size does not fit all. So absolutely, it's a very big application with cancer. Yes?
So if you do that with the cancer, do you wait to hear what chemo drugs they want to give you and then have the genome testing done?
I would ask the question right away. If you have cancer and they're considering chemo, you say, what can you do in terms of genetic profiling of my cancer cell type? And if they say they don't know, you go to another one. You go to another oncologist. That's leading edge, and when you have cancer, you want leading edge. You want the good stuff, you know? And I'll tell you one other thing while we're talking about cancer. Whether you need chemo or not, and all chemo is not bad, the problem is that they don't support, it's poison, guys. Chemo's poison to kill cancer. But they don't take care of the rest of your body. That's why people who take cancer, who take chemo, frequently become horribly ill and may die from the treatment. There is a whole new breed of physicians called naturopathic oncologists who work hand in glove with mainstream oncology to protect the rest of your body. So if you're facing chemo, call us, we'll give you names. Okay? Any other questions? You've been a great audience. Thank you.